thoughtful, articulate, artist, gifted, grammatical. Circular sources brimming with rich, flammable food for your thoughts, plated a different animal. Rounds on me, keep tabs, we insurmountable. Swerve, hey, Merle.
Everybody, happy Tuesday and welcome to another What's on Your Mind. It's my Tuesday lives that I do all about mental health and mental illness and just whatever's on people's mind that's currently affecting their mental health. I'm so excited this month. I'm being joined by some really amazing women psychologists and therapists. Oh, and there's my first guest.
Hey!
Hi! Thank you so much for joining me.
Thank you so much for the invite. I'm so thrilled to be here.
Absolutely. I was just telling everybody, my name is Zimare. I do lives Tuesday nights about mental health and mental illness, and then throughout the month I do lives on different topics. This month is Women's History Month, so I've just been telling the stories of other women. So it's been really nice. But I'm so excited to have you join us today. Do you want to introduce yourself a little bit?
Sure, yeah. I'm Dr. Kristen Casey. I'm a licensed clinical psychologist. I specialize in Arousal. I'm really interested in women's issues too, and I'm really excited to be here. So,
thank you so much.
Yeah.
And so when you say that you focus on women's issues, right, in the mental health field, because we all think, oh, mental health. What are some either mental illnesses or just tendencies that seem to be more stereotypical towards women or affect us more?
Yeah, so we noticed that women are 2 times as likely to be diagnosed with an anxiety disorder compared to men. So a lot of women struggle with anxiety, and we do notice that women are more likely to also experience insomnia as well compared to men. So there are, disproportionate rates of anxiety and insomnia among women. We do notice too, obviously, postpartum depression and things like that are more common among women because of biologics, right?
Yeah.
But yeah, those are the 2 things that I see the most in my practice. And I notice that when I work with women with anxiety, specifically, the anxiety usually and causes more anxiety. So that's really what I practice.
I think one of the hardest things with anxiety, especially for women, because we're taught, you have to juggle so much, you have to sort of have it all, and it's your job to kind of figure it out. And we, especially here in the U.S., get used to having so much stress. So like, how does someone tell when they're dealing with just regular stress versus when it's like an anxiety thing that they need to get help for?
Yeah, that's a really good question. So I like to look at the functioning. So you might be experiencing, rumination or worry about things in the future that you can't control. Like you said, women are juggling so many different things, especially women who are moms, women who take care of children and they have jobs and they have all these other things to juggle. The one thing that I really do focus on is it impairing your ability to function at work, in relationships, at home? Is it stopping you from getting things done? Are you kind of constantly in this state of like, I'm so anxious that I can't really do anything? At that point, I always say, hey, reach out for extra help, whether that's therapy provider or your primary care physician, whoever you feel comfortable with. You might even know other people in your life that have voiced, oh my gosh, I have anxiety too, and you could kind of get a gauge for what they do.
Okay, so it sounds like it's more when it starts impeding your everyday function.
Yeah. So, there's certainly ways that you could overcome anxiety on your own. And there are a lot of self-help books out there. There's a lot of YouTube videos, a ton of stuff out there. But what we really like to focus on is, are there things within your control that you could kind of have solutions for? And if you have those solutions, usually people are like, okay, great. Once I get that solution, check it off the box and the anxiety's gone. For people in the 21st century, it's not necessarily a checkbox item. It's financial struggles. They can't pay their mortgage. They're experiencing, microaggressions, racism, inequality, all these things, right? So it's really important for people to have support that they need, especially when it comes to like mental health, because if anxiety goes undiagnosed and untreated, a lot of times we notice that it does affect relationships. It isolates people, especially women, and I think it puts women in this place of like, I have all these things that I have to do and I can't really get out of this. And what am I supposed to do? So.
Yeah, I think that we deal with that a lot because we've also been taught like to say no to things is to be selfish, and being selfish is like the worst thing you could be. Yeah. When that's not really the case. And it's taken me a while to kind of like work past that. That's not really so much being selfish as it is self-prioritizing.
Total. I love how you describe that too. I love the concept of self-prioritizing, because I think especially with women, if we're using women as the lens, right? You're not only supposed to, like, let's just kind of use this as an example. You're not only supposed to be a mom, work, take care of the house, figure out how to be fulfilled, figure out how to be happy, right? Find a partner, all of these different things. And it feels impossible when you have anxiety. So I agree with you.
So with anxiety, because I have anxiety as well, and it stops me a lot from sleeping at night. So I think a lot of us, like when we can't sleep, we say we have insomnia. But like, what is actually insomnia versus like I'm just having difficulty sleeping?
Yeah, good question. So chronic insomnia is difficulty falling asleep, staying asleep, or waking up before your intended alarm, or dissatisfaction with the quality of your sleep that lasts more than 6 months. Acute insomnia, short-term insomnia, lasts less than that. So how I look at the differences here is chronic insomnia is recurrent. It happens at least 3 times a week where you're experiencing one of those symptoms, one or more of the symptoms. Acute insomnia is kind of like jet lag, you know, like you're in a different time zone, back, you're feeling a little off, and then you kind of get back on your feet. When we think about anxiety and insomnia, there's a huge correlation here. So when I work with people on their sleep, especially women, I really do focus on 3 things. I focus on your circadian rhythm, your body's natural sleep-wake cycle, and is that in line with, you know, your internal cues of sleepiness, and sleep drive, the body's biological need for sleep. Are you actually tired right before you're going to bed? And then the third thing is arousal, which is a fancy word for anxiety. So even if circadian rhythm is set, just say you're waking up at the same time every day and your body is pretty consistent and you're exhausted, you're not napping, you're not drinking coffee, and you're really active throughout the day, if those 2 things are handled and you have anxiety, it will keep you up no matter what, because it's a survival mechanism. So when people are and they're like, oh gosh, my thoughts are racing, you know, it's really difficult for them to get to sleep, because that's your body's way of keeping you safe. It's perceiving these thoughts as a threat, and it's going to keep you awake until you figure it out.
Yeah, I love that. Thank you, body. Appreciate it. It's
Right.
like you're in bed and you're thinking about like something you can't even control or think about.
Yeah.
Or like just happened years ago. It's so frustrating.
You're 100% right. I mean, I think when we think about it, this is like a really reptilian part of our brain too. And you know, back in the day, hunter-gatherer days, the threat was a bear, you know, trying to eat you and stuff. Now there's no bear, there's financial distress and all the things that we just talked about, right? That will keep people up at night. But there are so many tactics out there that people could use. And the main thing is relaxation training. How do I make my mind work for me and not against me as I'm trying to go to sleep?
Can you, because we talked about your circadian rhythm, can you really change that? Because like I've always been like a night owl, and I felt like after my teen years I would grow out of it and I'd become a morning person. That did not happen. But like early last year, I really like focused myself, because everyone's like, you're more successful if you're a morning person. And like I felt like I had trained myself to really like wake up at 6 and go to bed and be like tired by 11. And then I got sick and everything got thrown off, and now I'm having the hardest time getting back there. And I'm like, man, I thought we had fixed this. Like, so can you really change that rhythm? Like, if I'm a natural night owl, late sleeper, will that ever really change?
It depends on if you're doing like some sleep training. So if you're really trying to shift that circadian rhythm, we always suggest doing that under supervision, because sometimes it could really cause a lot of distress, and we don't want people engaging in sleep deprivation, which is like hours and hours and hours and days of not sleeping, right? So we want you to do this under supervision. So see a professional, of course. But what we typically do when I work with people in sleep treatment and they're trying to shift, we really shift it only 30 minutes per week. So really, really, really. So just say you want to be a morning person, right? If you go cold turkey and you just start trying to wake up at 6 a.m., you're going to just be shot, exhausted. You're not going to be able to function. Things to do, right? Yeah. Medical concerns, things like that. So we really try to shift by 30 minutes. A good example of this is daylight savings time, right? So we lose an hour and people are all kind of off and they're like, I can't even like wake up. So it's similar. It's like if you just kind of throw yourself into it, there is a way to change it, but I like to always focus on the preconceived notions and the myths. So people who are night people are just as successful as morning larks, people who wake up really early. I think there's this societal expectation that we need to wake up early, and I think a lot of people are working for employers, right? And there's certain times that they have to be at work. Maybe it's like a 9 to 5, or it's like an earlier amount of time. But we've noticed that when people are actually able to choose their schedules, right, that align with their body's natural rhythm, they're actually more successful. So for you, you might be saying, hey, I get all of my stuff done at night. If you get it done, you get it done, right? So, yeah. Yeah,
that's true. I would just tell my employer that. No, but it's true, because I do think that that's just where you're naturally more awake, and that's where you function better for me. Like, you'll get late emails, but you'll get them because that's when my body is like, and my mind is awake and wants to get stuff done. And I would rather sleep in.
Yeah,
But
yeah. Again, like with sleep treatment and working with people with insomnia, insomnia is, you know, difficulty falling asleep, staying asleep. There's over 70 sleep disorders. So it might not be insomnia. It might be like advanced phase sleep syndrome, advanced phase sleep syndrome. So people who have like a bed window that's typically later or earlier. So we notice in like elderly populations, people are going to bed like really early and waking up really early. So advanced phase. But if you want to change that, yeah, it's all a matter of like looking at that bed window and figuring out how many hours you need per night, because everybody's is different, and then using that bed window to kind of work in your favor. For example, I was a first responder for a while and I did overnights, and it was really difficult for me. I'm not an overnight graveyard shift sort of person. Just like wrecked my whole sleep cycle. So I had to switch to days, but I noticed that I worked really well with, you know, a swing shift. So like a 2 p.m. to like 11 sort of thing.
yeah, yeah, that's my.
Yeah.
I always liked that third shift. That was always like a good window for me. I know you said that everyone needs different amount of sleep, but like, is there a like a typical good spot? Because, you know, we grow up hearing like, oh, you should get 8 hours of sleep, but then you hear like, oh, if you're an adult, you only need like 6 or 5 or 6. So like, how much sleep should we be aiming for?
Yeah, there's definitely a general number from the National Sleep Foundation. And if you read Matthew Walker's book, Why We Sleep, I love him. I think he's just the greatest. He outlines things really well in terms of the research. He suggests, and the National Sleep Foundation suggests, anywhere between like 7 and 9 hours of sleep. And if we really look at that, I like to look at all the research, look at everything. And even within my practice, I notice that people are more like on the 6 to 9 or 10 range. So it really just, for example, you know, if I get 5 hours of sleep, I could function great. If I get any more than that, I am so groggy, right? And there's some people who are like, I can't imagine not getting 9 hours of sleep, right? So I like number as like a general rule for each individual, but then taking note of like, how did that sleep feel? Are you waking up feeling rested? Do you have that daytime grogginess and fatigue, right? So, you know, for other people, it might vary. So I always like to say 8 hours is nice to strive for, but it might not be ideal if you have anxiety, if you have other mental health concerns, PTSD. We notice women veterans specifically with PTSD, they have like a lot less sleep that they actually could achieve.
And how important is it to get like consecutive sleep in a night? Because like sometimes, especially if I'm like, oh, I'm so exhausted, I'm going to bed early, I'll then wake up at like 1 or 2 and be wide awake, but then I'm ready to go back to sleep at like 4, and then I sleep a few more hours. Like, how terrible is that, or is that okay?
Right. It depends on the person. So there are people that are segmented sleepers. Always say, what's going to work best for your day, right? So if you want that consolidated sleep, we suggest amount of time, depending on when your bed window is, that we determine in sleep. And to get consolidated sleep, we only get into bed when we have internal sleepiness, like we're nodding off. And if you wake up at the same time every day, then your circadian rhythm will kind of reset itself, and then melatonin start. Like, melatonin doesn't make us tired, but it starts this orchestrated event that lets our body know it's time to rest. And then it's like, oh my gosh, am I, you know, is it nighttime? You know, are there bright lights around? And then our body take those to fall asleep. But if we want that consolidated sleep, it is important, because we go through, you know, sleep cycles I think it's between 5 cycles a night, depending on how many hours of sleep. And there's a couple of stages of sleep. So there's REM sleep, and then there's N3, non-3. And every stage has its beauty, right? So there's all these different things, different stages of sleep. And if you're getting that consolidated sleep, you'll go through all of the cycles. If you're getting every hour, every 2 hours, that's not what we want, because you're not going through that sleep cycle. But if you're doing it in separate segments, that's not terrible either, because you're actually getting cycles.
Okay. So as long as it's like long enough, because I think I've read that like REM cycle is like an hour and a half to get the.
Yeah, it depends on the person. For example, like infants, they spend 70% of their time in sleep, whereas for us, the absolute opposite. So we change over. And with certain amounts of, or certain cycles of sleep, different things that happen. So in REM sleep, human growth hormone is usually dispelled. So for babies, that's really important, because they need to grow. Right? For us, we're already full grown. He doesn't do, you know, in terms of the amount of time. So, so yeah, with REM sleep, we have a lot that goes on in terms of memory consolidation. There's a lot that happens in terms of like emotional processing and stuff like that. And we have a tendency to our dreams when we're in REM sleep because our body is paralyzed. So that we don't act out our dreams. Of course, there are people out there who have, REM behavior disorder where they actually sleep talk, sleepwalk. They do all these weird things in their sleep, called a parasomnia. But yeah, it's really important to get consistent sleep, in my opinion, whether that's segmented or in one solid chunk.
And you mentioned melatonin earlier. A lot of us take melatonin to help sleep. Is that okay, or is that something that your body can, like, does that impact your body's ability to make regular melatonin if you're taking the supplement?
That's a great question. So our body makes melatonin regardless if we take it or not. When we take exogenous melatonin, meaning melatonin that's in a pill capsule form, our body tends to sometimes get confused. And what I mean by that is, if you wake up at the same time every day, your body will naturally secrete melatonin as you start to notice, as it starts to get those cues, meaning the light's kind of dimming, it's kind of feeling like time. Our circadian rhythm is really, really consistent. So it's in the suprachiasmatic nucleus within the hypothalamus. And really what it does is it really guides when we go to sleep and when we wake up. And consistency and exposure to light are the only two things that really, really maintain this. And that's all you really need, unless you have other medical conditions that inhibit you from falling asleep or that make you fall asleep too much, like narcolepsy or something. So if you are trying to do this without any medication, having no melatonin, it's technically not a problem. Depending on the dosage of melatonin too, a lot of it is secreted out of our bodies. So I have to double check with Matthew Walker's book. I can't remember the actual dosage. I'm also not a prescriber. So I think he does talk about, like, there's certain amounts that you'll take. I think it's over 3 milligrams is secreted out of your body. So when we take that melatonin, our body is like, oh, wow, we got to go to sleep. Holy shit. We gotta get all this stuff together. Like, let's get in bed. Like, woo. And then you go to bed. And then once that melatonin, the exogenous melatonin wears off, your body starts to think it should wake up. So people actually have more awakening at night, we notice. So I personally don't like taking melatonin, but if you are trying to get back on a sleep cycle from jet lag, I think it is helpful.
What are some other things that people can do to help with getting into, like, regular sleeping patterns or something? Because I think that consistency is best for your body, right? For trying to sleep, to have a time. So what are some things that people can do?
Yeah. So the biggest thing that I suggest is consistency. And I know it's not, it doesn't work for everybody because some people work shift work, some people have 3 jobs. I mean, sometimes it's just not helpful for those people. So any sort of consistency, meaning choosing the same shifts, choosing the same sort of job, any consistency that you could get would be helpful. But waking up at the exact same time every day, even on weekends, is super helpful for your body to maintain some consistency. Have a buffer time right before bed where you're not doing anything that's like anxiety provoking, and nothing that's like, oh gosh, I have to finish this thing for work, nothing stressful. And then only using the bed for sleep and sex. So no, not having anything that's going to kind of keep you awake and keep your mind going, basically. If you're on your phone in bed, I do it all the time, and I know it's bad for me. I probably should take my own advice. It does keep me up way longer than I would really want to, and I admit that, right? So it's all a matter of choice. Do I want to get to sleep at a certain time, or do I really want to watch this YouTube video, right? So consistency, exposure to light bright and early in the morning, an hour buffer time right before bed. I don't really focus too much on a bedtime, which might sound a little. So I only focus on the wake time because at night there's so many factors that could impede sleep. Like, am I anxious? Have I paid my taxes? Like all these things, right? That might keep you up. So if you're saying to yourself, I need to get in bed by 10 o'clock, and you're not tired, we don't suggest ever getting into bed unless you have those internal cues of sleepiness, like you're literally nodding off. For some people, it's problematic because they might not have those internal cues of sleepiness, and they're like, I need to be in bed at 10. What do I do? Focus on the wake time.
Okay, that makes sense. I wanted to ask you also, so, you mentioned like a little bit about some sleeping disorders and different things. And I think that we don't really talk about them a lot. Like, people think about insomnia, but that's about like insomnia and like narcolepsy. Actually, let's go to that one specifically first. What is kind of like with the whole insomnia thing, like how do you tell if it's just you're tired or insomnia? What are your signs that it's more than just like, oh, I'm sleepy and it might be narcolepsy?
Yeah, so narcolepsy is technically a medical condition, and we like for medical doctors to diagnose that as well. So when people see me, I ask them, how often are you falling asleep sleep spontaneously? Like, are you driving? Are you sitting? Like, and we call narcolepsy like sleep attacks. Like it's like an involuntary, insatiable need to just sleep. That's different than there are sleep disorders where people need a ton of sleep, like over 10 hours of sleep. It's different than narcolepsy because those people could kind of control a little bit of like, okay, I'm tired and I'm sleepy, but I'm not going to go to sleep. Narcolepsy is like, I am doing something, you know, that has a high propensity for risk, right? Like I'm driving and I'm literally the wheel. So with something like that, we do, the first line treatment for that is medications. So I always refer to my primary care or sleep specialist to prescribe medications because I don't prescribe. For insomnia, the first line treatment, which is so exciting, is cognitive behavioral therapy for insomnia, which is what I do in my own practice. There are people who prefer sleep medications, works for them, depends on what you want and what there are so many sleep disorders. So I do suggest for people, if you are experiencing something like this, to talk with not only your therapist, but also other sleep specialists. Because for example, sleep apnea, it's when we're not getting enough oxygen overnight. If we have a polysomnography, which is a sleep study, that's how we diagnose sleep apnea. We could diagnose it with a primary care, but we like to have the data, at least I do. I like to see how many apneas are they having a night. Some people are having like 60 apneas, meaning like they're not actually breathing overnight, and it's very so yeah.
And that
so
was actually going to be my next question. So I love that you asked that, or that you mentioned that, because, you know, I recently discovered that I have sleep apnea. And I think that for most people, like, especially when they see someone overweight, they're like, duh, of course you do. But it's not just for larger people or fat people. Like, there are slimmer people who have sleep apnea, but may not think to, like, look for it. So what are some signs that someone might have sleep apnea, whether it's someone, like, whether it's you signs to look for yourself? Or with your partner. Because I happen to be home and my mom's like, you sound funny when you sleep. So I was like, oh, okay. So like, what are some things to look out for?
Yeah, I love it. I love it. You're 100% right. Sleep apnea is not an issue just among people who, you know, are overweight. It's more about people who are gasping for air overnight. They're waking up gasping for air. They're snoring extremely loud and they're not getting enough breath. They're waking up with daytime fatigue. Like they cannot keep their eyes open, even after sleeping like 9 hours, 8 hours. So really what we look for is, you know, if you have a bed partner or someone that lives with you, are you waking up gasping for air? Do you stop breathing overnight? You know, if you notice the chest rise and fall, that's what I like to look for within the belly, because we use our diaphragm when we lay down and sleep as a way to breathe. So is the belly rising and falling, or is there kind of like a stop there? So looking out for that, snoring, gasping for air, waking up feeling extremely exhausted, like you can't function. I really always, even if people come to me for like depression, I always ask about sleep stuff, especially sleep apnea, because we notice that there's a higher propensity for cardiovascular accidents for people who have untreated sleep apnea for years. It's really to definitely get checked out if you have that.
Yes, definitely. And then another thing I want to talk about regarding sleep is sleepwalking. So it's not that common. And I heard that if you are sleepwalking past the age of like 12, then it's something you need to look into. But like up until then, kids might do it because of like the part of their brain they're in. Like, so is that true? Is that something that like adults should look for? Or if they have kids, like when is it not a problem if they're sleepwalking and when is it a problem?
That's a really good question. So I only specialize in adults. I do have a friend who does specialize in children, so she'd know more about this than me. But with any sleepwalking, I always say get it checked out because you just never know. You know, it gives you a sense of like instability in terms of physical walking. You could fall, you could hurt yourself, right? So if you do notice that someone is sleepwalking, it's technically a parasomnia, meaning like a behavior that happens overnight that's unusual, technically. Sleepwalking, talking, anything like that. I've heard of stories and I've had clients who have told me like, yeah, I've opened all my windows overnight and I didn't realize it. I'm like, well, it's the middle of the winter. You could have froze to, you know, things like, so I always say, get it checked out. Because what happens is when we sleep, and especially when we're in REM sleep, there's something that happens with our body where we become paralyzed. It's called atonia. So we don't act out our dreams and we don't act out overnight. And usually when people sleepwalk, sleep talk, and do all these things overnight, they have no recollection. They're like, I didn't even realize I did that. I just noticed a couple of cell phone numbers that I called at 3 a.m. I have no idea what happened. And they weren't drunk. They weren't using substances.
I was going to say, it's usually alcohol for me, but I know that's not.
Too many, I get it. You know, we all a little bit too much. But yeah, so I always say get checked out regardless of your age, because if you live alone, if you have stairs in your house, I mean, if, you know, you could just get hurt. And then if you live alone, you know, nobody you know, you can't even ask for help, right? Because you're
Sure.
home alone. With I'm not sure. Again, I would have to check with my friend who specializes in children with insomnia and apnea and all that, sleep disorders. But I want to say that it's more common in kids. I'm not exactly, so I'd have to double check.
Okay. So I've heard, and I don't know how true it is, so you can tell me, is there a better side to sleep on? Because I read somewhere that your left side is the better side to sleep on because more of your organs are there. And I don't know. I was like, but I thought maybe you could help me out with that.
I love this. I love this. So there's, from the research, at least with, you know, working with insomnia and disorders, to my knowledge, there's no like better side, but it's more about comfort. You know, if you're able to actually fall asleep. I do know just from being a medical technician, you know, if you are on your left side, it is more helpful in terms of if you're feeling ill or sick or something like that. But in terms of, we notice for people with sleep apnea, or if they do have a tendency to snore and stuff like that, sometimes laying on the back is not as helpful because the tongue kind of gets stuck and then the ability to go through. If you have a CPAP machine, though, then you don't have a problem with that because it's continuous airflow. Even if you are on your back, it's still okay. And most people are a little more uncomfortable on their back than they do on the side. But.
Yeah. Okay. Yeah, I was always wondering because it sounded interesting to me. And then I just had another question about anxiety because, well, I had two. So there's an anxiety attack, but there's or a panic attack, but then there's something else that's not quite a panic attack, right? And people confuse the two.
Yeah. So how I look at this from, if I look at the DSM, the diagnostic attack is a spontaneous feeling of physical anxiety where you kind of just don't really exactly know what's going on, but you feel like you can't breathe, you feel like an elephant sitting on your chest. It's like the typical panic attack, like I need to remove myself from the environment. When I hear the word anxiety attack, and my colleagues, you know, everybody has a different view of this, but when I hear an anxiety attack, it's this influx of intrusive thoughts where you feel like so anxious and worried about maybe a future event. You might not be as physical. You might not have the physical sensations that you would like a traditional panic attack, but it doesn't mean that you wouldn't, right? So if you're really anxious, you're thinking about what's going to happen next week and you're super upset about it, your heart might start racing, you know. But with panic disorder, the first line treatment for panic disorder is either medication. So sometimes people take, you know, a PRN medication to reduce the physical feelings of a panic attack. But what's even more effective, and we've seen from the research, is relaxation training. And the key here is when you have a panic attack, your body's in fight or flight. So your sympathetic nervous system is engaged. You're ready to like fight a bear, you know, like your heart's pumping, you're ready to and the way to stop that is to engage your parasympathetic nervous system, your relaxation response. I like to think of it like parachuting away from my stress. That's how I remember this. And with the parasympathetic nervous system, people are like, okay, what do I do? All you have to do is regulate your breathing. I know it sounds very simple and I'm kind of generalizing here and everybody's different, but if you could regulate your breathing, then you could regulate your heart rate. If you could regulate your heart rate, then your body's like, okay, we're actually good. We're okay. Yeah. You know, you just have to like convince yourself that you're okay. And usually we do that through breathing.
I actually learned that through because I have asthma as well. I'm a hot mess. But I would have like where I would start like hyperventilating sometimes when it gets really bad. And I learned to like really like just stop and control my breathing, and then everything kind of feels okay. And it's totally by accident. I've learned that with like other things as well. It's
so applicable.
With panic or anxiety attacks, I've noticed, well, no, mostly with panic attacks, like the aftermath of it feels so much worse than the actual anxiety, like the actual panic attack. Because I'll have like the heart fluttering, the can't breathing, all of that, and it'll last just a couple minutes. But like my stomach hurts for like an hour after, and I don't know if it's the like adrenaline or what it is, but the aftermath feels almost worse.
That's pretty common. I used to have chronic panic attacks as well, and I would just feel shot afterwards. And I'm like, all that for this? Like, really? You know, like what the hell? But yeah, the aftermath usually is the worst because with adrenaline and, you know, when we're ready, you know, and fight or flight is kicking in, we're not too worried about how our body feels in terms of like, you know, our stomach and gastrointestinal things, because all of that kind of goes to the wayside when our nervous system is engaged. we have a tendency to digest at a really slower rate or not digest at all, right? So it's really just focused on getting us ready to fight or go or flee or whatever. But yeah, the aftermath is actually really common for people. They feel physically exhausted. They might feel really down about themselves too, like feeling really low self-worth, self-esteem, because they're like, gosh, I can't believe that happened. And sometimes people get headaches too.
Yeah, I get them.
Yeah.
And then, we mentioned anxiety attack, which is just more a rush of like the intrusive thoughts and feelings and stuff. I think more people are experiencing that as well right now with just everything going on in the world. And I know for me, it's very frustrating because I try to keep it out, but then you just like it comes in. What are some advice or tips you give for people when they're experiencing an anxiety attack or even just an influx of anxiety thoughts?
Yeah, I mean, I think it's important to note that we have over 70,000 thoughts a day, right? So it's pretty impossible for us to like catch every single one and only look at the positives, right? So I think it's expectation management is important, right? So not every time that we kind of do these tactics, it will work every single time, so it just depends on what you have going on. But when I think of intrusive thoughts, I think of two things. I think of your body's trying to tell you something, right? Like, hey, pay attention to me, there's a thought coming up. And the second thing is that our brains are designed to keep us safe. They're not designed to keep us happy and joyful and pleasant. So they're geared for survival. So if there are negative influx of thoughts, your body, again, is going to perceive that as a threat and say, we need a solution. We need to focus on this. So the two keys here are catch it, check it, change it. It's a cognitive behavioral therapy tactic of like noticing the thought, you're catching it, checking it. Is this a thought? Is this a fact? Is this a feeling? Where did this come from? Is this going to happen? Has it happened before? Really kind of getting a deep dive into what it is, and then change it. I don't really like to change thoughts completely. I like to be curious about them. So is this thought actually helpful? Is this thought going to help me feel better? Is this thought going to help me get out of this headspace? And if it does, great, continue that, right? Most likely that's not the case. So I always say, is this thought helpful? And if it's not, I've trained myself to say, okay, we don't need it. Because your body is obsessed with finding solutions, right? And your brain is like, sometimes there is no solution. Sometimes it's just really tough. Life just really sucks, right? So we have to kind of let our brains know. That would be one tactic. The second tactic is, schedule worry time. So we use this for people with insomnia and anxiety as well. So if you notice that there's like an influx of intrusive thoughts and rumination and you can't really stop the cycle, you might do scheduled worry time. So it's actually, you carve out time in your day to worry about whatever is on your mind. And it sounds really counterintuitive, but if you set a timer for 30 minutes, it's gonna be the longest 30 minutes of your life, and it's gonna be over. So it has three parts. It's worry identification, worry delay, and then the worry time. So if you're noticing I'm at work trying to type this email and I'm just getting all these thoughts, you delay that to the worry time that you have at 1 p.m. And then once you actually delay that worry, you're training your brain to say, we don't right now, right? And then once you actually schedule that worry time, you'll notice, okay, I'm worrying. I don't have a solution for this one, but I have a solution for this thought. So let me act on that. And the one that I don't have a solution for, I just have to table that for now. And then if you notice later, oh gosh, I'm worrying again, but my scheduled worry time isn't until the next day at 1 p.m. Well, guess what? We got those. Yeah. So those would be the two main ones.
I love that. As I said, I've done that before. I didn't know it was a real thing.
Hey, you're doing it all. I love it.
And I really love the catch, change,
to check it,
because that is actually one of the best things that my therapist, I use it for both my anxiety and my depression, because especially with my depression, I'll get down on myself a lot about like, you didn't do it, all that, and stopping it and really asking myself what's real and what's not real about it has been a huge game changer.
I'm so happy to hear that it works. Yeah, I've been using that for quite some time, even before I became a therapist. And I was like, oh, wow, this is actually cool. This actually works,
Yeah. Well, I can't thank you enough for your time today. I really appreciate you meeting with me and chatting and answering all my questions. I was looking forward to talking. So thank you very much.
Thank you so much for the opportunity. I just want to come on here and say, like, I love your page and I love your movement, and keep going.
Thank you.
Like you in the world. So
thank you very much. Thank you. And you're welcome back at any time. All right. And thank you so much to everybody who watched as well. I'll be back next Tuesday. I'm here every Tuesday and throughout the month. I'm just always here. I live on Instagram apparently, but it's a good time. Thank you all, and you have a great day. Bye.